Constipation is a silent threat for all cats, but especially cats with chronic kidney disease. Do you know how to spot the warning signs early and prevent it? I'll show you the litter box clues that every cat caretaker needs to know and why they're important. Let's dive in. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. Cats with chronic kidney disease are prone to dehydration and metabolic imbalances, both of which slow digestion and lead to constipation. Left unchecked, constipation can worsen kidney function, lead to extreme discomfort, and even emergency room visits. We've known to watch for constipation in cats for a very long time, but recently we're learning more and more about what's called the gut-kidney axis, or how nutrition affects the gut, which also affects the kidneys. And I'll get to that in more detail later. But let's talk normal stool first versus what's concerning. And I'm going to apologize up front for the food references, but it's a really good way to get the point across and get the visual across. A healthy stool in a cat should really look like a Tootsie Roll. It's soft to firm, segmented, and easy to scoop. You don't want it to be too big, you don't want it to be too small. And if this video hasn't been weird enough for you yet, welcome to my life. We spend a ridiculous amount of time in veterinary medicine talking about poop. And this video is all about it. Concerning stools are small, they're dry, they're hard, they're like pellets. On the opposite end, you can have thin ones or ribbon-like ones. None of these descriptions are normal for what poop should look like from your cat. And texture matters. Hard, segmented stools means the gut is slow and the stool has sat in the colon for a long period of time. Thinner ribbon-like stools can mean that there was straining involved, or the gut's moving faster, or we have fiber problems. While nobody likes to play in the litter box, it is very important to look in there because you can gain a wealth of information. Small shifts in what's going on in that seemingly stinky box that you probably hid in a corner somewhere can be early warning signs, and we need to jump on those. I've said it before and I'll say it again. Cats are masters at hiding their illnesses, so we need to look for these tiny little subtle clues to let us know something is changing. And as odd as it may sound, if you truly want to be proactive about your cat's care, you need to look in that litter box. I'd even recommend you go a step farther and create a litter box log. Now, there are smart tools out there these days. There's something called a petivity monitor that'll clue you in when your cat is urinating in the litter box or defecating in the litter box. Some of them will weigh your cat for you. Those are all great pieces of information, but I also want eyes on that litter box so that I know what it looks like. So a daily log kind of forces you to do that. You want to look in the litter box at least once a day, and you want to note the texture of the stool that you're seeing, or the consistency, or the size, or is it even happening on a daily basis. The smart tools aren't going to give you that description, making your eyes the ultimate tool in this battle. Once you start that log and get used to what your cat's stool looks like, then we can use that information. So what are some things that can cause poor stool quality in cats? Well, in our chronic kidney disease cats, probably the number one thing that we're concerned about is dehydration. Dehydration will definitely lead to constipation, either in the short term or the long term. Other causes can involve medications, changes in diet and fiber content, abnormal gut bacteria, problems with nerve function to the gut, and even stress, as well as some other things too. But these are our major players. Knowing those major players means we can do something to potentially prevent constipation, or worse yet, obstipation, where the cat can't go at all. As I mentioned a minute ago, hydration is one of those big ones. If your cat has vomiting or diarrhea, they're losing more water than they should be. So we have to be really proactive about this. If they have chronic kidney disease, there's more water going through their body than being kept in their body in a normal cat. So we have to stay up on that, making sure our cat is hydrated. And if they're sick with any other illness, we really have to be aggressive about keeping their hydration up. That will help keep these stools normal. You also want to be really careful with diet changes. It's not that we can't change diet, it's just a matter of that red flag being raised in your head to say, okay, I'm switching diets, so now I need to keep a close eye on my cat's bowel movements in case the fiber content between these two foods is going to affect the quality of that stool. Be aware of medication side effects. It's not often that medications cause constipation. Usually we're more worried about diarrhea, but there are medications that can do it, or even supplements that can do it. For example, phosphate binders with chronic kidney disease can be an issue. So you want to know what you're using and what those potential side effects are. Comfort is another big player. This is one we don't usually think about, but this is things like, is it easy for your cat to get to and access the litter box? Do they have arthritis? Are we keeping them comfortable enough that they can posture appropriately in the litter box and have a good bowel movement? If they can only stand for so long and only have so much of a bowel movement, they could get constipated. And then of course there's the stress aspect. Some of our kitties just really can't handle changes, or they get easily stressed. They'll be hiding, they'll avoid the litter box, they'll do all sorts of weird things, and that can lead to bowel movement issues as well. I alluded to arthritis, but mobility is definitely something to keep in mind. Even if your cat doesn't have arthritis, if they have another problem causing mobility issues, we need to factor that in. The cat needs to be able to get to the litter box, in the litter box, use the litter box, posture appropriately for an appropriate amount of time. This all factors into the regularity of those bowel movements. And then, as I had alluded to earlier, gut flora and probiotics can also be a factor in this battle. A common question is, when should you be concerned, or when should you call your veterinarian? And a couple rules of thumb are: contact them if your cat hasn't produced stool in the last 48 hours. I cringe when I hear people say, my cat hasn't pooped in 3 to 5 days or 5 to 7 days. Would you want to go that long? That is not normal, and it is painful. So if it's been more than 48 hours, contact your veterinarian for some advice. If your cat's straining in the litter box without any results, if they're vomiting or their appetite has gone down, if they're crying in the litter box, if they're laying near the litter box, or any combination of these things with lethargy, those are all red flags that mean I want to be in contact with a veterinarian so that we can assess the situation before it gets far worse. And now I want to circle back to that chronic kidney disease and gut bacteria topic that I had mentioned before. So it should come as no surprise that what our cats eat affect their gut. But more importantly, what our cats eat affect the normal flora or bacteria that are in our guts, or in their guts. So there's bacteria in everybody's guts, humans, cats, dogs, all of it. And it's usually a topic of discussion and or argument depending on which rabbit hole you go down online. But suffice it to say, there is what is considered normal flora in a healthy animal gut. We know that cats with chronic kidney disease have abnormal flora, or their flora is different than a normal cat. And a lot of studies have gone into this recently to determine, is this something that we can impact? Is this something that can slow kidney disease? How can we potentially use this as another tool in our toolbox? And constipation, of course, factors into all of this as well. So in a very simplistic view, our cat eats food. That food is broken down into nutrients in the gut. Some are absorbed into the bloodstream, some remain in the intestines and work their way through. The ones that stay in the intestines have the most impact on what that normal gut flora or bacteria looks like. In a healthy cat, the waste products from protein metabolism are broken down in the gut and moved out in a timely manner in stool. With a cat with CKD or chronic kidney disease, their gut isn't normal. They're not healthy. So things are going to be different. Things are going to change. And oftentimes at some point in the disease, these protein byproducts or uremic toxins build up in the bloodstream, they build up in the gut. We know they make cats feel really crummy. So we're constantly looking for ways to affect this. Well, what we're learning is that these uremic toxins predispose our chronic kidney disease cats to abnormal gut bacteria, or bad bacteria, so to speak, which not only mess with their metabolism, it also makes them feel crummy, and it just is this spiral. And if you add to that a slow GI tract, meaning we've got mild constipation going on, or we've got stool sitting in the colon longer than it should, it potentially allows the body to reuptake some of these uremic toxins or pull these toxins out of the stool back into the bloodstream, forcing the kidneys, which are already compromised, to deal with them again, or they build up in the bloodstream, making the cat feel even worse. So when we look at that aspect, or we look at that system, meaning the gut system and the normal flora or the abnormal flora, and we figure in chronic kidney disease into this, we already know while we classify different systems in the body, everything's tied together. But these two together hold promise potentially in treatments, future treatments for chronic kidney disease. It is also where products like Porous 1 have come in, where Porous 1 is specifically targeting a uremic toxin that is not being filtered appropriately when we have kidney disease, making the cat feel crummy, affecting the gut flora, all of these things that I just mentioned. So it's an area of study because it's going to potentially allow us to come up with new treatment options for chronic kidney disease. But when it comes to constipation, it makes it even more important that you know that your cat's stool quality and texture are normal and that they're going regularly. Because the last thing we want for our CKD cats is for this stool to be spending extra time in the body or in the colon so that the body is trying to resorb some of these toxins again and they need to get processed over and over. Not that we want to give our cats diarrhea. Do not hear me wrong on that. That's got its own set of issues. But we want to keep that stool moving through the body appropriately so that we're not complicating chronic kidney disease any more than we have to. Needless to say, stay in tune in the future because this is a huge area of study that is going to impact how we manage chronic kidney disease. And of course, there's always a bunch of companies or people or what have you that want to jump on these bandwagons early and start promoting all of these supplements with all of these claims. And while we do have some products out there that are very beneficial and we have somewhat of a handle on some of this research, there's a lot of questions that need to be answered as well. So when it comes to products and topics in this area, I would encourage you to have this conversation with your veterinarian. But again, it's where products like Porous 1 are coming in. It doesn't mean you should just willy-nilly grab some probiotic and it's going to fix the problem because there are very specific bacteria involved. So I want to be optimistic on this aspect of this video, but at the same time, word of caution, there's a lot to be learned here yet. So we can use some of what we have learned and we can use it with our chronic kidney disease cats. But a lot of what is being promoted out there is also a lot of theory without backing to it. So just be cautious there. And the take-home message is make sure your cat's pooping appropriately. That's one of the best things you can do for them. But let's recap. So make sure you're checking that litter box daily. Make sure you're using that litter box log so that you know what you're looking at. You want to know the size, the texture, all of those things. And you want to make sure your cat is hydrated to the best of your ability. We all know cats have their own agendas sometimes. But if this video helped you, go ahead and save it so that you can come back and reference it in the future. And please share it with other cat caretakers so we can get this information out there. Take care, and I'll see you on the next video.